Hello, everyone, and thank you very much for joining us today. My name's Deborah Garlick from Henpicked Menopause in the Workplace, and author of the book Menopause, the Change for the Better. And today's session has proved to be so incredibly popular in terms of how many people have registered for this session. And I really get it. Menopause and dementia. How many times do I hear people saying, brain fog? Do you recognize that word yourself? I thought I was losing or I thought I got early onset dementia, or I thought I'd lost my ability to remember names and nouns. And so that's what we're going to be discussing today. And we're going to be welcoming back Dr. Clare Spencer from My Menopause Centre, and congratulations to the team at My Menopause Centre. Claire, I think you've got outstanding in the Q in your Care and Quality Commission report?
Yes, CQC inspection gave us an outstanding, rating. So we're really delighted. Hello, everybody.
Well, we're not surprised, of course, but congratulations to you and the team. And I was just saying, menopause and dementia, the registrations for this session were absolutely huge. And absolutely understand that. We hear that from women all the time. I thought I was losing, somebody said to me the other day, I thought I was losing my marbles. But it's one of those ones we all get at some point, or do we all get it at some point? So what we can explore in this session, if that's okay with you, is brain fog as a symptom, but also we hear a lot from people around, or we see things around research around dementia, and HRT helps protect us. So if we can explore that a little as well, because I'm sure my dad's had dementia, and it's horrible to watch somebody deteriorate. It's a really nasty thing to experience for the individual and for all of those around them. So is HRT the panacea? Is it going to make a difference? But first, if we can focus on brain fog as a symptom, is it correct? It's due to us experiencing fluctuations in hormones. What's actually going on in our brains?
Yes, thank you, Deborah. So great questions to ask. So basically, what happens in the menopause transition is our estrogen fluctuates and it drops. And what people don't sometimes realize is estrogen is really important for the functioning of our brain in many different ways, how the neurons connect to each other. There are estrogen receptors in really crucial bits of our brain that are important for memory and cognition and those sort of higher functions in our memory center, word finding centers in our brain. So we know that probably around 75% of women in one study, that was the Channel 4 Fawcett Society data, so over 75%, 3/4 of women said that they experienced what they would class as brain fog at some stage in the menopause transition. So it's really common. And one of the causes of that will be as a direct effect of loss of hormones. But another cause of that will be the impact of other symptoms on cognitive function. And so, for example, we know that if you have hot flushes, that can impact on memory. And so if you can help the hot flushes, sometimes you can help the memory. But also think about how you feel if you've had a night of no sleep or broken sleep or very little sleep, or how you feel that you function cognitively if you're depressed or low mood or flat, or if you're really anxious or you're feeling stressed. All of those symptoms can also have an impact on our cognitive function. And the main symptoms that women will complain of are difficulty word finding. I'm sure we can all identify with this. Certainly I can when I've been giving a talk and just think, what's the word? Difficulty recalling words and numbers. Disturbances of daily life, so walking into a room, forgetting why you've walked into the room, misplacing common items, your phone, your keys, your glasses, difficulty concentrating, so absent-mindedness, losing a train of thought. I hear this all the time in clinic. easily distractible and forgetting things, forgetting appointments, saying, I've never forgotten to go to the dentist in my life. Suddenly, there you go. So that's the broad overview. It's really common and it's really far reaching, and it's often difficult to pinpoint exactly why.
It's funny you should say that, because I think I've got it today. It's kind of, I feel like I've got a bit of a satellite delay. My brain and mouth aren't quite working quite as in synchronicity as they should be. And one of the things that I've understand about myself is when I'm more likely to get it. It might be a bit of a strange thing, but listening to you saying, actually, when you've not slept, certain things, times of stress, I know that's when I'm more likely to experience it myself. So so that's a relief. Thanks for that.
And if I can be really reassuring, so if you look at all of the studies that examine cognitive function, I found it really reassuring to know that higher order cognitive function, so executive planning, thinking, like project planning, doesn't seem to be affected. All of those other little bits, they're not little at all, are fine, but often women really worry that this is it. They can't do it anymore. They can't function, can't do their jobs. It really knocks confidence, but that sort of higher function seems to be preserved.
Oh, well, that is a relief. Thank you very much. So it might be that I just can't remember the end of the sentence that I just began, rather than actually my real brain that's
Yeah.
going on and can still function normally. And actually, sometimes it's how you feel how you think people perceive you. Yesterday, I was at an event, and a woman was saying to me that her boss finishes her sentences. And when she first said it, I was like, that might be awkward. You know, if you're in a meeting and somebody starts finishing the last word, or sort of filling in the gaps for you, if you like, you can actually take that the wrong way. But one of the, and I actually said that to her. I said, do you actually mind that? Does that not make you feel uncomfortable when that happened? And she says, no, we have a great environment now in our organisation where we're very open about menopause. His wife's experiencing menopause. We have a great relationship. And when you know this man, her boss, actually does it, she says, I know it's because he's got my back, and everybody else knows he's got my back.
Yeah.
With this, so there's no embarrassment about it. So actually, there's the reasons why it happens, and recognizing in yourself, but also having, if you like, the coping mechanisms or people around you that don't judge you for having a little bit of brain fog, knowing perhaps that the top, the most higher order, did you call it, part of the brain is still, so you're still you. It just means that you've got these, I always refer to it as my Wi-Fi's gone down. Bear with me, it'll come back at any point when hopefully it'll come back at any point. So it is a real thing.
100%.
What can you do? What's the best things to do about it? As I was just talking about coping mechanisms and how I get through it, and sort of maybe sometimes say, you know, my word will come back to me. Might take 3 hours, but it'll come back.
Yes, yes, exactly. And sometimes then when you just take a step back and breathe, the word might magically pop into your brain. So what can you do about it? Okay, this is a $92 million question. Sometimes if you can relieve some of the anxiety about memory issues, then it can help. And so people think talking therapies for cognitive symptoms, talking therapies for brain fog, but actually things like cognitive behavioral therapy can help break down exactly as you've just described, Deborah, in the workplace setting. So it can help break down some of the embarrassment and some of the stress that you can have when you think about symptoms. And if you can get rid of the negative thoughts about the symptoms, actually your memory might improve marginally and just take away some of the anxiety. So other strategies, so all of the lifestyle advice applies to cognitive function. So exercising at least 150 minutes a week. There's a good evidence-based. Reducing alcohol, stopping smoking, good Mediterranean diets can actually help cognitive function. I know it sounds a bit of a cliche, but really making sure you're still using your brain. So getting those neurons firing by learning something new, whether it's on Duolingo or other language learning or instrument or dancing, anything where you're learning, you're putting new information into your brain. We've spoken about exercise, we've spoken about relaxation, socialization as well. So talking to people. So isolation can really impact on cognitive function. So ensuring that you're part of a community, WhatsApp group of friends, talking to people can also help protect your brain for the future. Managing cardiovascular disease risk factors like blood pressure. I haven't spoken about HRT yet, have I? But
No, I
all
was
of
just
those
waiting.
things, yeah, are really, really important. Hormone replacement therapy. This is really interesting. So we just don't know. There are no studies that have looked at the impact of taking HRT in the perimenopause, where women are often starting to experience these symptoms. We just don't know in terms of studies whether HRT is helpful. I talk to many, many women and they do find HRT has helped them. There is no doubt. And that part of that is really likely to be due to the fact that you're helping manage a lot of the other symptoms that can be impacting on cognitive function. So HRT can be helpful, but when you actually look at the studies, it's only helpful in small ways. It may help, for example, verbal memory marginally. And actually, we really don't know how helpful it is or not in the perimenopause.
That's absolutely fascinating, because the reason I wanted to sort of talk about HRT as part of this is because I do see things that make it sound like, I'm being blunt here with you, that HRT is the panacea, A, for the symptoms, and B, for the long-term protection against dementia. And I don't know what I don't know on this subject. And I don't know, I try to read up on things. I'm a member of the British Menopause Society and International Menopause Society. So, if something comes up about brain fog and dementia, because I know it's one of my legendary symptoms, I wonder if I'm ever going to get past it. So it triggers, or it will prompt me. But so what do we know and what don't we know about how much protection against dementia HRT gives us?
Yeah, and again, studies are really tricky to interpret. So I think this is the summary of what we know. So if you have a menopause under the age of 40, or if you have a surgical menopause where your ovaries are removed for whatever reason, cancer treatment, cancer prevention, then taking HRT is really likely to help protect your brain against dementia. It is likely to have a protective effect. We don't know exactly the best type of HRT. We don't know exactly what the best type of dose is to be neuroprotective, but it is really likely that it does have a protective effect for younger women, or if you've had your ovaries removed. When we come to looking at population data for women going through the menopause at an average age, even though we know that our brains do need estrogen, and so it makes sense that estrogen would be neuroprotective, when we look at the studies don't seem to, on the whole, when we take the whole lot of them in one go, show that it does have a protective effect, which is very interesting. So we say to women going through the menopause at an average age between the ages of 45 and 55, please don't take HRT to prevent dementia. The studies at the moment don't indicate that that's the case. For older women, there is some data actually showing that if you start HRT over the age of 65, it may even increase the risk of dementia. We don't know if that is true or not. It may have just been a glitch from that one study. It may be the fact that that was older type of HRT that was taken in that study. So I don't want women to be scared about taking HRT over the age of 65. And certainly other studies haven't shown that. But it is interesting, isn't it, that there's still very much yes, no, even though we have all this data at our fingertips. So we say that HRT doesn't increase the risk of dementia. HRT for younger women may prevent it, but it probably doesn't prevent it from the data we have at the moment if you go through the menopause at the average age.
So it really is, you know, a unique, you know, individuals may experience this differently, whether it's symptoms management or longer term protection.
Yeah.
It comes down to a good conversation with your healthcare practitioner. And when is all of that research going to be done then, Claire? You know, because
Well,
you
exactly.
just put me in an older category there.
Yes. No, and you know, there is some research that if you carry a particular lipoprotein, then it may be that there was some quite good research showing that if you had this particular genetic susceptibility to Alzheimer's disease or dementia, then actually estrogen might be helpful. But that was, you know, that's definitely emerging data because we're not routinely checking for that particular genetic susceptibility at the moment. So I think it's a big watch this space. But certainly, if I can reassure that the risk of early dementia, so the incidence of being diagnosed with dementia under the age of 65 is literally 0.01%. So if you are experiencing these symptoms in the menopause transition and you're thinking, yikes, what's going on? Have I got dementia? The absolute chances are the answer is no, you are in the menopause and you don't have dementia.
Yeah, that's really helpful.
Mhm.
So, you know, what I'm cycling back then, because HRT then doesn't sound like it's the panacea for absolutely everything. And, you know, be careful what you read and where your sources are when you're reading those. Going back to the lifestyle, because a lot of the things that you were saying there doesn't just help brain fog, it helps with other symptoms as well. And, you know, I know we focus a lot on symptoms, but actually that a lot of that is just good sense for whatever stage of your life you are, or whatever part of your transition, whether you're perimenopause or post-menopause, that just makes good sense for us just being in good health.
Absolutely, absolutely, absolutely. And, you know, there are many different types of dementia. And one of those types is vascular dementia, which is linked with heart disease. So if we can reduce our risk of heart disease, again, you can reduce your risk of vascular dementia. It's not straightforward. It's quite nuanced. And if you are concerned, as you've said, Deborah, just to reiterate, a discussion about you, your risk factors, your family history with a doctor is a really good way forward, because we've got all this population data, but it applies to population and not individuals. So think about you and how things apply to you.
Fabulous. Thank you very much, Dr. Clare. And I can see, Sally, we're getting lots and lots and lots of questions in chat. I'm going to go off and read that now and let you interpret the key themes that we're seeing there and answer some of those questions.
Absolutely. I mean, I think, first of all, as we always say, the sharing is amazing. And what's been lovely is so many people are saying, reading all of this makes me feel better because I realise it's not just me and I'm not. And I think that's a massive thing of this, isn't it, Claire? Just that appreciation, understanding that this is a very common symptom that people can experience during menopause. And I think there's, if anyone wants to, it's quite an amusing YouTube video about menopause symptoms, the loss of nouns. There is a bit of swearing on it, but it's a comedian and she basically describes one of her menopause symptoms as a loss of noun. She said, I've got adjectives coming out my ears. She said, I can see a chair. I can tell you what you do with it, where it is, what colour it is, what size it is. But can I remember the word for a chair? Not a chance. And I think we've seen someone couldn't remember the word for a paperclip. Shared it with that. So really normal. We get this, definitely. Okay, so let's work through the questions. I think a lot of people were saying around, does it get better, brain fog, as we go through menopause? And although we know hormones don't, we start at a lower level, but they maybe balance out, because a lot of people are talking about what's the experience like post-menopause and will it go away once you get into that post-menopause? So just talk about that a little bit.
Yes. So the positive of all this is generally most symptoms improve in the postmenopause after an unspecified and undefinable amount of time. You know, memory can improve, and cognitive function can improve, and no, absolutely. And what's really fascinating is literally pathways in your brain are changing as your estrogen levels drop. So it's no wonder that we start to feel a bit discombobulated. But as things resettle, it's like throwing everything up in the air and letting it resettle. It may not resettle quite back where it was at the beginning, but in general, symptoms do improve. So please do be reassured.
Yeah, absolutely. And I think we've heard that from people in postmenopause, saying actually they feel kind of brighter, lighter. Not everybody, and we know some symptoms can go on for further for people, and some experience into postmenopause can be challenging. But I think for a lot of people, it can actually be quite a liberating time, and something to kind of look forward to. And I know in Japan they talk about it as that second spring, which I think is a really nice way to think about this next stage. Someone's asked around, does menopause cause the occasional jumbling of words when talking, or is it more likely to be linked to, they talked about B12 deficiency, so pernicious anemia. I'm just wondering, are there any other, I guess, medical conditions that can also be brain fog, or that kind of fuzzy thinking or jumbling of words could possibly be related to?
Yes, oh no, that's a really good question. Yes, no, low B12 and B6, if you're anemic, thyroid dysfunction, any sort of medical condition that impacts on sleep, or medication that impacts on sleep, or drowsiness. So yes, there are many different reasons to feel like this other than the menopause. Absolutely.
Yeah. And I think someone's also talked about the people who are neurodiverse. Someone's talked about having ADHD, and again, how menopause may exacerbate some of the symptoms that people are experiencing. And just wanted, if you've got anything to add around that.
Oh yeah, that's a really good point. Absolutely. I'm so glad people are talking about this now, because often what happens is you may have ADHD and have coped all your life. You've developed coping strategies to get through and function exactly how you need to function. But then in the perimenopause, when your estrogens start to fluctuate, because we know the fluctuation can cause symptoms and can impact really on resilience, and estrogen levels drop, again impacting on symptoms and resilience, that those coping mechanisms are blown to bits. So I commonly talk to women who are now asking the question, gosh, this seems to be having more of an effect than I think it should be. And if that is the case, then there are big questionnaires that you can fill out. Usually, if you contact your GP, if you're thinking, have I got ADHD? I know we certainly provide the forms, and people will sit down and fill them in. The NHS referrals at the moment are years long in various parts of the country, but there are often ways through chosen providers. So absolutely, it's definitely a thing. And I'm so glad we're talking about it, because then again, it helps women see that there might be another way through this.
Yeah, absolutely. And it leads us on to that question around, when should somebody be going to explore whether what they're experiencing is early onset dementia, is potentially a sign that something else is going on? So that kind of understanding the difference between a menopause symptom or a symptom relating to something else, and actually that understanding if people are actually struggling with their more long-term cognitive function.
Yes, no, that's a really good question. And I can't underestimate the amount of anxiety that this causes, particularly when you're looking after an elderly relative, for example, watching somebody with dementia. And if we think, so dementia is the term for several diseases that affect memory, thinking, ability to perform daily activity. You can see that awful overlap. Dementia itself is usually preceded by other symptoms, and they may include mood changes, behavioral changes, confusion, etc. Again, you can get that in the menopause, so that's probably not very helpful information. But in dementia, symptoms usually just progress. They just carry on getting worse. There's something else about it. Whereas in the menopause, generally it comes and goes. and it may be that you're having other symptoms of the menopause alongside it. There is a screening tool that your GP can take you through called the 6-point cognitive impairment test that you could Google. You can't really do it on yourself. You need somebody to ask you the questions. It's a pretty crude screening tool, but it might be just reassuring that when you go through that. But look, if you're concerned about it, speak to your doctor. If they're concerned, they can refer you to the memory clinic. Particularly, older women who may have symptoms that just aren't getting better, or you think they may be progressing, don't wait, because actually, if it turns out to be dementia, there is medication that can slow that progression. So try not to bury your head in the sand. And number one, try to be reassured. I think most women will be reassured when they look at the screening tools. But if you're worried, just go and talk about the worry.
Yeah, absolutely. And I think my mum has mixed dementia, and she's now very, very poorly, but she was diagnosed over 10 years ago. And it took a bit of tenacity. And at first it was, just getting older, that it wasn't really kind of like understood. But once it was diagnosed, she was on medication. I would say the first 7 years of diagnosis, although she had some challenges, actually the medication that she took definitely delayed what she's now experiencing. So I would absolutely agree with that. It can feel quite hard to tackle, but actually really, really important to get that support and help as early as possible. So people have also asked around how long to be on HRT for. And I think that's a general question, but I think in terms of managing those symptoms and then also long-term health, and just any kind of thoughts or guidance around that.
Yes, no, absolutely. And before I answer that question, Sally, can I just really mention something that just came to me when you were just speaking? Again, if you're experiencing these symptoms, we touched on different conditions that can mimic those symptoms, like thyroid dysfunction and low B12. There are a whole host of other important diagnoses that you need to rule out. So can I just reiterate, there is a whole host of blood tests and head scans that if you are having another reason to go, if you're experiencing the symptoms that are not settling. So how long to take HRT for? Oh my goodness, it's so variable. And we don't know how long you have to take it for to get any long-term benefit. Certainly, if you're under the age of 40 with a menopause, if you've got a surgical menopause under the age of definitely 45, taking HRT at least until the average age of the menopause is important. So you've got the estrogen for what you would have had during normal reproductive span. I usually say take it for as long as you want to take it for. When you're in a really good place, you might be feeling great and you might want to just reduce the dose and see how you feel. If you reduce the dose and you feel fine, carry on reducing the dose. And you may be absolutely right as rain. If you reduce the dose and you're feeling shocking again, then take the dose back up. So, yeah.
That's brilliant. And I think just to find out, because I know we're getting very short on time, is just around, we're not saying that HRT is the only thing here, are we? Because people are saying, is HRT a must, should we take? But I think there is so much else that we can do to protect our brain health.
Absolutely. As you heard me right back at the beginning, rattle off all of those different factors. It's not just HRT. HRT may be a component, but it's not the only component.
Yeah, and I just think finally, I know we've had loads of questions in general around HRT. We've actually covered a lot of those in some of our other lunch and learn sessions, specifically around FAQs around HRT. So we'll make sure we send links to those included with this, which will actually answer a lot of questions. I know there's questions around osteoporosis and all sorts of things, and we've got some really great sessions that really cover all of those. But yeah, thank you so much.
Thank you very much. And I would say, agreeing with you, Sally, there, that do go on to the Henpicked Menopause Hub, because I know before ever we do a lunch and learn, I'll get so many people emailing saying, oh, for some reason I can't make it today. Will it be recorded? Could you send it? Every single one of our lunch and learns that we've ever done. So there's a huge back catalogue of specific conversations like today's on menopause and dementia that you can watch at any time. They're all free. They're all expert. There's no paywall or anything else. They're just designed to help you experience and survive and thrive through your menopause. And as you said, Sally, there's a lot of them on HRT, or how to have a good conversation with your healthcare provider, your doctor, your GP, and other things around nutrition. So lots and lots of resources that are available there. Or also My Menopause Centre website is very, very good. So lots of information. I would say always do check your sources, because every time I see one coming up saying HRT is going to will stave off dementia, we've just heard it. That's not proven yet. I do hope, Claire, that we do get some research that gives us a lot more clarity, because it does feel like there's more gaps at the moment than there is certainty. And of course, we've all got to appreciate we're all unique in this. So knowledge is power. Read up, understand what's going on for you, understand what you want to do about it. And we hope, the reason for doing this in the first place is to help everybody manage their menopause in the best way possible. And so that just leaves me to say thank you very much for joining us today, and thank you very much for the wonderful Sally Leach and Dr. Clare Spencer. I hope you have a lovely weekend. All the best. Bye.